The questions that I choose is, what is orchiectomy? What organ system can be affected? Explain. Orchiectomy is a surgical procedure to remove one or both testes or testicles. There are lots of indications in orchiectomy, such as prostate cancer, cancer of the testes, torsion of the testes, and male-to-female surgery. The organ system that can be affected is the scrotum of the male reproductive system, because the doctor needs to remove the testes from the scrotum to prevent from prostate cancer and testicular cancer, and avoid to spread the bacteria and infection from the other parts of the body.
Orchiectomy or orchidectomy surgical procedure wherein one or both testicles are removed from the body. Orchiectomy results in a variety of side effects, including osteoporosis, loss of muscle, sex drive, and erectile dysfunction. This is common to transgender women to choose to have a orchiectomy when transforming male to female. The organ system will be affected by this procedure includes the skeletal and muscular system. Also endocrine system, these effects can be mitigated by help of hormonal replacement therapy.
An orchiectomy is a surgery done to remove one or both of your testicles. It is commonly performed to treat or prevent prostate cancer from spreading. An orchiectomy can treat or prevent testicular cancer and breast cancer in men too. It is also often done before sexual reassignment surgery or SRS if you are a transgender woman making the transition from male to female. This is classified into 4 types: the simple orchiectomy, radical inguinal orchiectomy, subcapsular orchiectomy, and the bilateral orchiectomy. Bilateral orchiectomy causes infertility and greatly reduced testosterone levels, leading to loss of sexual interest, erectile dysfunction, hot flashes, breast enlargement, weight gain, loss of muscle mass, and osteoporosis. The administration of hormone replacement therapy after orchiectomy can help to mitigate the negative side effects. An orchiectomy is an outpatient surgery that doesn't take long to fully recover from. It's much less risky than hormone therapy for the treatment of prostate or testicular cancer.
Orchiectomy or orchidectomy is a surgical procedure wherein one or both testicles are removed from the body. This procedure is classified into 3 types, which are simple orchiectomy, subcapsular orchiectomy, and inguinal orchiectomy. Simple orchiectomy involves removing the testicles and part of the spermatic cord from the body. Subcapsular orchiectomy is done by removing only the glandular tissue around the testes instead of the testes themselves, and is also done to treat prostate cancer. Inguinal orchiectomy, also called radical orchiectomy, is performed for early onset testicular cancer, wherein the entire spermatic cord is removed along with the testicles. Orchiectomy results in a variety of side effects, including osteoporosis, loss of muscle mass, infertility, weight gain, loss of sex drive, and erectile dysfunction. Organ systems affected by this procedure include the reproductive, skeletal, and muscular systems.
Orchiectomy or orchidectomy is a surgical procedure in which one or both testicles are removed from the body. The surgery is typically performed as treatment for testicular cancer, in some cases of testicular torsion, as a gender-affirming procedure from trans women. The procedure is classified into 3 types, which are simple orchiectomy, subcapsular orchiectomy, and inguinal orchiectomy. Simple orchiectomy involves removing the testicles and part of the spermatic cord from the body, and is done for sex reassignments, testicular torsion, and some cases of prostate cancer. Subcapsular orchiectomy, the tissues around the testicles are removed from the scrotum. This allows you to keep your scrotum intact so that there's no outward sign that anything has been removed. Inguinal orchiectomy, also called radical orchiectomy, is performed for early onset testicular cancer, wherein The entire spermatic cord is removed along with testicles.
Acquired immunodeficiency syndrome, or AIDS, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, or HIV. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease. TB is a disease that usually affects the lungs and sometimes affects the parts of the body such as the brain, the kidneys, or the spine. TB disease can cause death if it's not treated. Pneumonia is an infection that inflames lungs, air sacs, or alveoli. The air sacs may fill up with fluid or pus, causing symptoms such as cough, fever, chills, and trouble breathing. People living with HIV are more likely than others to become sick with tuberculosis. This is because HIV weakens the immune system, which makes it harder for the body to fight TB germs. In short, it could be possible for the tuberculosis or pneumonia. It will be a symptom for AIDS.
There's a long list of organisms that cause pulmonary infection in HIV. The good news is that the epidemiology helps, and the list of organisms usually encountered by a non-infectious disease is much simpler. The other ones are going to be rare disease we don't see as commonly. Streptococcus pneumonia is the most common cause of bacterial pneumonia, and it is more virulent and more likely to be invasive in HIV patients. Bacteremia is incredibly common in HIV or AIDS patients. With Streptococcus pneumonia, remember that the rates of bacterial pneumonia do depend on CD4 count. The lower the count goes, the more likely it is to be bacterial.
Is it possible that pneumonia and tuberculosis could be symptoms of AIDS? Why or why not? Yes, it is possible, because people with AIDS have weakened immune system. They are more prone to infections and diseases that could harm our body. One of the symptoms of AIDS is dry cough and pneumonia. When a person's immune system is weak, latent TB infection can quickly progress to TB disease. If you have HIV, it is very important to get a TB test. People living with HIV are more likely than others to become sick with tuberculosis. This is because HIV weakens the immune system, which makes it harder for the body to fight TB germs.
People with AIDS at risk for recurrent bacterial pneumonia. Bacteria can infect the lungs, which may lead to problems ranging from a mild cough to severe pneumonia. Recurrent pneumonia is most likely to occur when the CD4 plus T cell count falls below 200 cells per cubic millimeter of blood.